You get my idea now, right? So pure to give you a framework. To give a framework for an area of purpose. We know that not all purposes are the same. And, find some purpose that's bigger, the higher, the better. The same area is vulnerability. You have to be responsible for your future, your well-being. The third area is understanding yourself, understanding your role in life. Okay? The last point is enjoying life. Life becomes meaningful, more fulfilling. Okay? So Matt, have a water phrase. Anybody else come with any question first? Any question about the pure model? No, have any.
Okay.
Yeah. So any person want to come out to present a case helping someone in trouble? Come on. Yeah.
Okay.
Hi. Hi, Laura. How are you?
So, for this case, I will pretend that my name is Sarah and that I'm a 60-year-old woman who is in a relationship with her spouse, I believe in the complete, absolute sanctity of marriage. But when I married my spouse at 40, I only married him because it was like the last chance for me to have kids. And then I had this wonderful job that brought me so much meaning, but I had to give it up when I had kids because they said I wasn't allowed to work part-time, and it's a field that I can't go back in once I get out of it. So I have no meaning in my life right now. That's where I'm at.
But the case is supposed to be that you're this case is not look for meaning.
No?
This case is ABCD. Look over ABCD.
CD, yeah.
The case about you tell me you're in a real stressful situation, a real problem. Just tell me the nature of the problem you're
Okay,
in.
so nature of the problem is I don't know what to do with my relationship.
Relationship with whom?
Yeah, because I want to find meaning in my relationship. Is that okay?
That's still meaning. I'll find a case.
I picked one of the two halves.
Find a case that person have
Is that too
a
tricky?
trauma, have a real difficulty trying to get out.
Oh, so would you rather me pick a scenario where it's difficult to get out of the scenario?
Think about a more terrible situation.
A more terrible situation. Okay.
Oh, okay.
New
How
thinking
about
hat.
being abused by someone or some
terrible
more
situation.
scary situation?
More scary. Okay, I'll come up with a scary situation. All right. I'm in the military, and say I'm a military chaplain.
Okay.
I'm a man. I'm a military chaplain, and I can't tell my colleagues that I'm suffering from PTSD because otherwise that would spell the end of my career.
So you're a chaplain, and you're suffering from
post-traumatic stress disorder.
Yeah. Because you witness so much violence, so much death, and you want to that's a good case. Okay. But you pass, okay?
I pass. You can't hear me? Is that better? I have to go like that? Can you hear me now? Hello? Is that better? Now you can hear me. Okay. Did you heard what the case was? Okay, good.
Okay. What is the chaplain's name?
Matthew.
Matthew. Hi, Matthew. I can understand how you feel. I can't imagine what I would do if I have worked with so many broken people. I witnessed vicariously, as well as first vicariously, so much trauma, so much suffering. Any normal person with so much exposure to terror.
Flashback. Flashback.
Huh?
Sorry, I said flashback. Sorry.
So dramatic, it's so dramatic. Wait, okay, now. I'm sorry that bring you back trauma. This is called, I don't want to re-traumatize you, okay? Well, just imagine that we are in a safe place, just you and me, comfortable clinic. So I don't want to re-traumatize you. I'm sorry about that, okay? But are you ready for me to talk? So it's a difficult topic. This is a difficult topic about trauma. War is the most hideous, horrible kind of human evil ever invented or inflicted by man on other people. Okay? So it's such an unfortunate situation. Okay? I'm glad that you have chosen to risk your own life and to be chaplain, war chaplain, to go with the army. So that is really noble. So I affirm him now. So that is a noble calling, a courageous calling. So I'm grateful that people like you were willing to risk their own lives, risk their own well-being to help young men and women in uniform. Okay, so I affirm her, okay? And then I switch down to A now, A, B, C, D. A means acceptance, okay? So you know that for most people, love is full of suffering. You know that suffering has been with us since the beginning. Particularly for the military, because when they are in active duty on the front line, engaged in battle, with bullets flying through them, flying around them. So not most people can imagine how can you survive in that situation. But that is what armies, what soldiers face. They put their life in danger day in, day out, because they want to defend freedom, defend their countrymen. So they have a calling too, okay? But we have to realize that human beings are equipped to cope with stress. The basic instinct of flight or fight, okay? But as a chaplain in your case, neither seem to be suitable, right? You cannot quit the job of flight, right? Or cannot fight the war for them. So flight or fight. So neither one will work for you, right? So what do you think will be the best way for you to adapt to the situation? Because life is about adaptation, right? We survive for millions of years because we know how to adapt to the situation. So as a chaplain, how do you adapt to your role as a chaplain who have to hear and witness horror every day? What the best way to adapt?
Well, I suppose when I think about having to go to people's houses and tell them that their child has passed away, that their son has passed away, or their daughter has passed away, and that they might have to consider organ donation or all those sort of things, maybe what I should consider is that I'm there to support them and that I've been there to support so many families. And even though it's a really hard job, I've supported people.
Okay. Now, have you heard the statement by Nazi, by the philosopher Nietzsche? He said that whatever doesn't kill you makes you stronger. Now think about that. They say the trauma either kill you or make you a stronger person. So now you are falling apart. You're falling apart because of the trauma you hear every day.
I can't talk to anybody about it, except for you.
Yeah, so you're falling apart. So your life is falling apart because you can't handle it anymore, okay? So there are two possibilities, right? One is maybe you are not suitable for the job. The possibility, right? Can you consider that as an option, that maybe you don't have the toughness, you don't have the inner reserve to expose yourself to trauma every day? Maybe, are you thinking about getting out of it? Is that an option?
It's everything I've always known, but maybe there are other options.
So I'm exploring options with her now, with him now. So sometimes maybe you're in the wrong profession. It's possible, right? You really can't hack it. There's too much pain, too much suffering, too much for you to handle. So getting out is an option, okay? Now, if you, after the discussion, if you feel that your heart is still in a job, you still want to serve the military, okay? So now we have to find some way to adapt. We agree?
Mm-hmm.
Yeah. So the first thing we need to consider is learning to accept the painful situation as part of your life. That it's by your own will you choose to embrace this way of life. Learn to danger, expose yourself to danger, listen to horror. That's your calling. That's your cross to bear. You bear the cross willingly. Nobody else forced you. You did it of your own will. Is that correct? It's the vulnerability now, right? So you bear the cross. You're willing to sacrifice, willing to suffer, because you think you have a calling, okay? Your mission. You accept that, okay? So think carefully. Is that how you feel about your job? That you embrace it, embrace the challenge, embrace the cause, because you're born for this job. You're born for time like this. You're called by God or called by higher power to play that role. We have some discussion around acceptance. So finally, you agree that you're willing to accept everything, okay? So, but there's still, you're willing to accept it, willing to endure the pain, but you still feel miserable. Still feel miserable. So work on B now. B means believe now. So I ask you, I say, do you believe that your work is worthwhile? Do you believe that the surface man find help from you.
Mm-hmm. For sure.
So you feel that you're able to bring comfort and encouragement to the young lads and ladies
Yeah.
who are facing danger in their life.
The only challenge is if I'm in the middle of if I'm in the middle of working with someone and then I have a flashback while working with them. That's what I find is. Oh, sorry. Can you hear me now? Why is it? Hi. Oh, there we go. Okay. The only challenge, even though I feel like I'm being helpful, the only times where I feel like I'm not being helpful is when I'm working with people, when I'm meeting with them, and then I have a flashback in the middle of it, and I'm not in the room with them anymore.
Okay. So let's work on the. We don't have time to get too much. So we work on that she had to come to believe that she had a useful role to play, even though sometimes she feel inadequate, okay? Feel that she's not able to help, okay? But do you believe that even though not, but in the end, when I come to hand, do you believe that some of the people who seek help from you eventually get better?
Yes.
Yeah, so some to get better. Okay? Not all of them, but some to get better. Do you feel good about being able to help them? Yeah, you feel good. Yeah. So that confirms that you're in the right place. Yeah, you're in the right place. Now, so after we have established strength of belief, so see, now what you do is that you have confirmed that this is indeed your work, so you know what lies ahead. What lies ahead is that you need to commit yourself. You need to commit yourself to receive further training, to improve your skill, to toughen yourself, and continue to seek your own healing of your brokenness to the point that you feel more comfortable to work as chaplain. So that commitment period is a stage of working hard, learning new skills, examine yourself, work on your own problems, consult experts. So it's a time of hard work. So are you willing to make you a better chaplain, more effective chaplain, without the personal PTSD? Right? Are you willing to seek help, seek healing, continue to work with me until we able to help you to discover, to help you to overcome? So we have to continue to work, okay? It's the commitment period, okay? The last period, not last, the second one is D, discovery. When we are working together, I would say, see, now you discover some area of strength that you did not know you have. Now you're able to touch a dead person without feeling sick. Now you're able to hold a broken limb without shaking. So that's growth, right? It takes time. It takes training until you're able to develop more tolerance to those horrible sights of broken limbs, of dead people, of dead children, and dead young man and woman. It's sickening. But you start me after the period of training, you discover that you do have the stomach to do it. Okay? So A, B, C, D. And E means that you can now enjoy your work better now, right? If not, then we can evaluate where else we need to do some fine-tuning. This is roughly the idea, ABCDE. So give Laura a hand for